Well, good evening. And thank you all for coming out to the first of our Discovering Our History forums. So, many of you here may have been a part of our Forgotten History Forum series, which is still continuing. But that 12-part series, which we began at the start of this year, obviously we heard from people that 12 was just not nearly enough. And so we needed more. And while we had an exclusive deal with PBS Western Reserve, we are so glad to have the first of our 5 Discovering Our History forums, and we're partnering with WAOH-TV, who is broadcasting tonight's forum and will broadcast the remainder of this series. Tonight, the Discovering Our History forums begin with the Akron Health Department. And by the way, if you are or were a former member of the Akron Department of Health, could you just raise your hand? There we go. So obviously, you all run deep. Yes, yes. Thank you for being here with us. We're also looking forward to our upcoming history forums, including the Discovering Our History series and our Forgotten History forums, which are continuing. We want to just announce a few of our upcoming forums and history hikes that are coming up. Our next Forgotten History Forum series will be October 14th, and this will be Akron Sound Movement Part 2. Our Part 1 was quite an occasion and quite a crowd, and backed by popular demand, we will be again partnering with the Summit FM radio station, and we'll also be honoring an Akron Sound legend, a 91-year-old Ruby Nash Garnett, who still lives here in Akron, so of Ruby and the Romantics. So make sure you come and be back with us on October 14th, right here at 6 p.m. Also, later this month, we have another Forgotten History Forum series that will be on October 28th, which will be on the research and legacy of Dr. Shirla McLean, and that will be held at the Dr. Shirla R. McLean Gallery at the University of Akron. Our next Discovering Our History Forum series, and since we're starting with the Akron Health Department, we decided that the next best one would be the Akron Water Department, and that's going to be October 22nd. So October 22nd, we'll be right back here, and we have to give our huge thanks to our friends and partners at the Akron Summit County Public Library, both Pam Hickson-Stevenson and Mary Plazzo, who is just amazing. She's very shy, but she's in the back row, and she has helped us tremendously on all of these forums. I also want to thank our Akron200 staff, both Jacina Chapman, our operations manager, and also Rose Vance Grom, our historic research and programming coordinator. I can't believe I got all of those titles right. Again, we are so thankful to have you all here. For more information about this series and all upcoming forums, please visit our website at akron200.org. You can sign up for our weekly e-newsletter, and that will help you keep up to date on everything that is coming. So at this point, I am so glad to introduce Bill Keck. When I first talked with Bill, I think I first met Bill via email on a correspondence that you, myself, and Dave Lieberth were on. And it's been a pleasure getting to know Bill, and we are really looking forward to this engaging forum on the Akron Health Department. Please help us welcome Mr. Bill Keck.
Well, thank you all, and thank you very much, Mr. Greer. As you've already heard, my name is Dr. William Keck. I'm a former director of the Akron Health Department, and I'm pleased to also welcome you to this evening's forum. We hope that our session will give you a better idea of the contributions made by the Akron Health Department to the community's health. With me today as panel members are Greg Irvin, on my immediate left, former Deputy Director for Administration. Next to him is Dr. Marguerite Erme, former Disease Control Medical Officer and Emergency Preparedness Coordinator. And next to her is Mr. Michael Smiley, former housing administrator and deputy director for administration. Each of us will try to bring to life different elements of the health department's activities. The city of Akron's health department, from its inception in 1881 through its official inclusion in Akron's 1966 charter, until its consolidation with Summit County Public Health in 2010, contributed substantially to the welfare of its community. Unfortunately, as time passes, many of the notable achievements and valuable lessons learned during its almost 130 years of existence risk being abandoned somewhere along the trail of lost historical narratives. During its formal existence, the department had a significant and positive impact on the health and well-being of Akron's citizens, still evident in the community today as carried forward by its successor. The story we wish to share here explores the history of public health in Akron, of how it continually evolved in an ever-changing environment of scientific progress, appreciable variations in available resources, and an ever-expanding list of recognized public health responsibilities. It's an earnest and instructive narrative of adaptation, some calculated risk-taking, strategic partnering, community engagement, workforce development, hard work, and fortuitous coincidence that has allowed the department, I think, to punch above its weight. Key to understanding the department's work over the years is an appreciation of the principles employed, as shown in this slide, in efforts to promote health and obviate disease and injury through the prevention and control of environmental risks, communicable and chronic diseases, and more recently, a recognition of the critical impact of social determinants of health and their role in the pursuit of health equity. We will each provide some perspective on the importance of these key principles listed on the slide and offer some illustrative examples of their productive use, which has helped guide us to where we are today. We only have time to discuss those that are in bold print on the slides that accompany each speaker. Well, collaboration with other individuals, agencies, and institutions was one of the most important principles guiding the health department's work. Resources inadequate for the job at hand meant that progress often depended on partnering with others whose mission overlapped that of the health department. Our partners were many, from both the private sector and government. Chief among them, in terms of resources committed and impact made, were the community's hospitals. Historically, response to infectious disease outbreaks, such as the Spanish influenza pandemic of 1918 to 1920, was enhanced by hospital health department collaboration. In the late 1970s, this type of partnering was formalized by the establishment of an ad hoc infectious disease consulting committee with both hospital and health department representatives tasked with communicating about outbreaks, agreeing on the best public health and clinical responses, and working together with the medical community to enact the best control measures available and communicate clearly with the public. In 1983, the hospitals and health department agreed to work together to address some of Akron's important public health problems using hospital money and health department sweat equity. A committee with representatives of all entities involved reviewed the community's public health issues and decided to focus on childhood immunizations and getting high-risk, underserved pregnant women, particularly teens, enrolled in prenatal care. The resulting programs continued for decades with good effect. A different form of collaboration began in 1978 when legislation was passed by the Akron City Council to develop an emergency medical response system in the Akron Fire Department. The legislation named Akron's health director as the chair of the Mayor's Emergency Medical Services Advisory Board, tasked with designing and overseeing this new system, developing policies and procedures, and establishing working relationships between the fire department, the 4 community hospitals at the time, and private ambulance companies who would back up the fire department and transport non-life and limb-threatening illnesses and injuries. The EMS Advisory Board was given just 6 months to get the system up and running, a deadline that was met. The EMS Advisory Board continued its work to evaluate and improve the system for decades thereafter. And it was during the 1980s that human immunodeficiency virus, or HIV, was first discovered and began to spread rapidly across the globe. It wasn't long before Akron identified its first cases. Soon the hospitals were operating diagnostic and treatment clinics, and the health department was involved in widespread community education and HIV prevention activities, especially targeting high-risk groups. As the infection spread and created significant severe illness and death, a variety of agencies developed to respond to the prevention, medical, social, housing, and other needs of infected individuals and high-risk groups. Funding from state and federal sources was funneled through the health department, and we required that funded agencies work within a collaborative consortium to be sure that resources were spent wisely, duplication of effort avoided, and competition minimized. And then in the mid-1990s, a student project evolved into an effort to develop a federally qualified health center, or FQHC, intended for medically underserved communities in Akron. An application to receive federal funding was failing, and the health department was asked to get involved. We decided, after much thought, to do so, and had to start from scratch since there was no existing clinical entity that could transition into an FQHC. To proceed, we asked the hospitals to join us and to provide both technical assistance and matching funds for a federal grant. The planning process was complex and, at times, contentious, but we were eventually successful. In 1997, Akron Community Health Resources opened its doors. Today, the FQHC is called Access Point and has expanded to work in both Summit and Portage counties, caring for about 18,000 patients annually. And it was in the late 1960s, much earlier, during the tenure of Dr. John Morley as director of the health department, that the Akron Health Department first established a small in-house laboratory to support its clinical services. The lab expanded in 1969 when it occupied space designed for it in the new Morley Health Center. Over the years, its services grew to include a large range of hematologic, serologic, and urine testing in support of the department's well-child, prenatal, sexually transmitted disease, hypertension, HIV, jail health, refugee, and addiction services clinics. Health departments in Steubenville and Stark County used the lab, as did Asian Services in Action and Pediatrics of Akron in Summit County. In the early 2000s, the Ohio Department of Health closed its Northeast District laboratory, and the Akron Health Department lab absorbed the staff, equipment, and responsibilities of that facility. Staff were certified by the American Society of Clinical Pathologists, and the laboratory was certified as meeting standards set by the Ohio Department of Health. The capacity of the laboratory was matched only by the Cincinnati Health Department's lab, among the few health department labs that existed in Ohio. Now I'd like to turn the session over to Mr. Greg Irvin. Greg?
Thank you, Dr. Keck. Tonight, I'm going to talk a little bit about taking calculated risks and managing efficiently and effectively. That was done in Akron. The Akron Health Department and the Northeast Ohio University College of Medicine, NEO-UCOM, now the Northeast Ohio Medical University, NeoMed. Among the risks that the Akron Health Department was taking was the recruitment of Dr. C. William Keck to serve as both the director of the Akron Health Department and a professor of community health science at NEO-UCOM. In the fall of 1975, he assumed the duties in January of 1976. The combination appointment forged a union between public health and the practice and medical education. Medical students preparing to become physicians receive training in public health, helping them to better understand the public health and the community. The Akron Health Department was considered an academic health department and was unique to Ohio. The link between the Akron Health Department and NEO-UCOM benefited both organizations, their employees, and the community. As the faculty member and mentor at NEO-UCOM, Dr. Keck helped shape the public health curriculum, helping medical students prepare for the many details in preventive medicine, health promotion, and epidemiology. His teaching expanded beyond the classroom and led students into the field to witness firsthand the impact of public health initiatives in the community. He was instrumental in fostering partnerships between NEO-UCOM and the regional public health agencies, laying a groundwork for collaboration, research, and service projects. He championed the idea that every physician should be a public health advocate, encouraging students to consider the broader context of patient care. The Akron Health Department's counseling division is a very key component of the health department. The health department counseling division started in the early 1960s and as an outpatient clinic treatment program for alcohol addiction in the greater Akron area. The division, quite unique among health departments, provided not only addiction counseling, but some medical assistance for withdrawal symptoms at no cost, and carried a caseload of over 1,000 for many years. The counseling division addressed the needs of individuals and families members. Services were provided at no cost and were entirely confidential. A court outreach program was developed that enrolled individuals in counseling services, setting aside sentencing for participation in the counseling services. This program was a precursor of many of today's drug courts. The counseling division developed, expanded, and offered employee assistance programs. Participation in the employee assistance program could be voluntary or could be required as a condition of employment in some cases to help an employee keep their job. Debriefing police and fire personnel following critical incidents was another key factor for the health department. The services helped ensure police and fire personnel returned to work and focused on their duties. The counseling division focused on prevention and education. Prevention programs were presented to the general public in schools and other facilities in the community. Public health counseling and employee assistance were vital pillars of the framework of mental health and wellness for the Akron community. Public health counseling helped provide the psychological well-being for the community on a wide scale. EAP focused on supporting the mental and emotional needs of the workforce for the city of Akron. EAP focused on supporting these important areas. General counseling, addiction services, and EAP played a critical role in fostering resilience, guiding individuals through the personnel and professional challenges, and enhancing the overall quality of the community. The counseling division was led and managed by many years by Jim McCormick and psychologist Sandy Clark. The leadership helped keep the division focused on equity, ensuring individuals, regardless of their background or employment status, had access to high-quality mental health services and support. Critical competency was the hallmark of the services provided, fostering respect and responding to the unique needs of Akron's diverse population. Next, I'll talk a little bit about the block grant funding. The Akron Health Department block grant funding and services were shared with the Barberton Summit County Health Departments to better serve the entire population of Summit County. The Akron Health Department, under Dr. Keck's leadership, coordinated grant development and services with fellow health directors, Dr. Martha Nelson, the Summit County Health Department, and Joe Harrison, the City of Barberton. Each department would assume a leadership role in a specific block grant, such as children's health or chronic disease prevention, and share resources and services with the other health disciplines. The clinics would serve all county residents. The collaborative approach, rather than a competitive approach, made more services available and reduced the administrative costs of providing those services. A single grant application was submitted on behalf of all three health departments. Any Summit County resident could visit a clinic within the Summit County, and regardless of its location. The collaboration helps lead for the development of a community and county infectious disease reporting system for Summit County. The three health directors met regularly to review the progress of each grant and make adjustments needed to improve the delivery of services. The collaborative management of the county's block grants helped set the groundwork for the eventual combination of the Akron, Barberton, and Summit County Health Departments into Summit County Public Health. The transition from block grant funding to, the transition from categorical funding to block grant funding reduced funding levels during the 1980s and made the collaboration, coordination, and cooperation exhibited by the three health departments in Summit County to be even more important in providing public health services and prevention and treatment services to all residents of Summit County. In order to better manage the health department and cope with the programmatic loss, or the impact and loss of 40% staff to the recession of the early 1980s, Dr. Keck implemented a management by objectives and results program. This management tool for the organizational effectiveness was popularized by Peter Drucker in the 1950s and has shaped the management thought and practice for over 70 years. The MBO process sought to align individual and divisional performance with the overall department goals, making strategy actionable at every level of the health department. The result component underscores the importance of measuring performance against preset effective objectives, and thus emphasizing accountability and continuous improvement. Each manager collaborated with Dr. Keck to set measurable goals for their division. Collaboration was the key to success. Rather than a top-down approach with the director setting goals and objectives, managers empowered to set goals and objectives for their divisions, thus increasing buy-in from the manager and their staff. Collaborating with the director, each manager participated in a goal-setting process. Together, they identified goals and objectives that supported the department's mission to promote and protect the health of all people in Akron by providing leadership, advocacy, education, and comprehensive health services. The goals were specific, measurable, achievable, relevant, and time-bound, ensuring clear expectations and solid foundation for the performance assessment. There were quarterly reviews to check the progress toward meeting those objectives. The MBO process allowed the director to hold the manager's feet to the fire and help keep the divisions focused on reaching measurable goals. The MBO process produced results and helped keep the focus on improving the health of the community and the environment in a time of very limited resources. Now I'd like to ask Dr. Margot Ermy to discuss more important areas of the Akron Health Department. Dr. Ermy.
Thanks, Greg. Good evening, everyone. I get to talk about two of my favorite subjects, communicable disease and emergency preparedness. Yeah. The control of communicable disease is a core responsibility of public health departments. And Akron in the early 1900s, like the rest of the United States, was plagued by infectious illnesses. There were few vaccinations, no antibiotics, and no tests to identify new infectious agents or diagnose the ones that were infecting the people of Akron. There were no requirements for communicable disease reporting, and the statistical reporting of birth and death records and response to communicable disease cases was not very well done. Despite a lack of effective clinical, preventive, and treatment strategies, the control of communicable diseases was at the forefront of Akron Health Department activities. There was a focus on controlling the spread of infectious agents by assuring access to clean water, inspecting raw milk, placarding houses where residents had a communicable disease for isolation and quarantine, and dealing with complaints such as outdoor toilets, dirty yards, and trash. During the 1918 influenza pandemic, Dr. Nesbitt, who was the current Akron Health Department health director, instituted widespread public health measures such as quarantine, isolation, restriction of movement, masking, and cancellation of public events. While these did help curb the spread of influenza, they were not met with enthusiasm or widespread compliance, predictive of public response to another pandemic about 100 years later. That influenza pandemic did, however, spark a realization that there needed to be changes and improvements in public health institutions and practices in Ohio. In 1919, Ohio passed the Hughes-Griswold Law, which required county and city health departments to have a uniform structure and a minimum number of full-time employees. It also required health districts and departments to engage in health data collection, control and prevention of communicable diseases, food safety inspections, birth and death record maintenance, inspection and abatement of nuisances, and as written in the original legislation, quote, all steps necessary to protect the public's health and to prevent a disease, end of quote. This later brought forth a state law mandating the compulsory reporting of communicable diseases, which is a core element of both detecting and responding to outbreaks of infectious diseases. The health department provided nursing follow-up of tuberculosis cases, provision of antitoxin against diphtheria for school children, establishment of a venereal or sexually transmitted disease clinic, assurance that milk was free of tuberculosis through cattle inspection, and training for milk producers, and mandatory smallpox vaccination for children beginning school. During the 1950s, as vaccines, antibiotics, and improved diagnostic capabilities emerged, the health department began mass blood testing for syphilis and antibiotic prophylaxis for rheumatic fever by detecting and treating scarlet fever and strep throat. In the next several decades, the health department operated venereal disease clinics, a tuberculosis clinic in conjunction with Edwin Shaw's Tuberculosis Sanitarium, and a centralized immunization clinic. Mass measles and rubella, or German measles, immunization programs were also conducted. Until recently, Summit County had 3 separate health departments. I guess it's not recent now, it's like 15 years ago. So it's still recent to us. Ohio law required hospitals, laboratories, and physicians to report communicable diseases to the health department in whose jurisdiction the person lived. This could be very confusing for the people and institutions that were reporting the communicable diseases, because you could have an address with a zip code that indicated you lived in one city when you actually lived in the jurisdiction of another health department. But Summit County was really fortunate in that the 3 communicable disease units in the individual health departments worked well together and subscribed to the belief that germs do not respect geopolitical boundaries, and cooperated in communicable disease investigations. And this cooperation led to the establishment in 2001 of a centralized communicable disease registry, the first of its kind in Ohio. And in this registry, disease reporters in the Summit County, which were the hospitals, laboratories, physicians, could now send reports to a single place, which was housed in the Akron Health Department. And from there, the reports would be distributed to the Akron Health Department, Summit County Health Department, or Barberton Health Department, depending on where the person lived. This really streamlined and simplified both the communicable disease reporting and communicable disease response. One of the other things that was very much at the forefront of the Akron Health Department was nursing. And beginning in 1916, public health nursing became one of the more visible aspects of the Akron Health Department. And you can actually see pictures of them in their capes and their little hats going out into the public. Initially entitled Division of Child Welfare, nurses established child care clinics in Akron schools, as well as a venereal disease clinic. I guess we're getting the wrong impression about Akron back then, and worked to control communicable disease spread, especially tuberculosis. Over the decades, the scope, responsibilities, and duties of Akron Health Department public health nurses evolved. They worked on issues as diverse as immunizations, hypertension control, sexually transmitted diseases, refugee health, prenatal care, pediatric health, employee health, breast and cervical cancer screening, and care coordination for children with multiple medical conditions. They assisted with disease outbreak investigations and emergency planning. The Akron Health Department Division of Nursing also oversaw the Women's, Infant, and Children, or WIC program, which was enacted in federal legislation in 1975. The public health nurses and dietitians worked to ensure that children from lower socioeconomic families got a healthy start in life by providing the means for pregnant women, infants, and children to get nutritious food and monitoring until the age of 5. The Division of Health Data Management compiled and analyzed birth and death records and made copies of these records available to individuals. The analysis of these records were able to identify trends in prenatal and birth risk factors and infectious and chronic disease and injury trends for causes of death. The data could also and was used in the evaluation of community health status and the development of programs to improve it. In the early 1990s, the health department began evaluating its own organizational capacity and its role in the community by using an instrument called the Assessment Protocol for Excellence in Public Health, or APEX. With this tool, the Akron Health Department worked on improving its internal capabilities. In 1994, the Akron, Summit County, and Barberton Health Departments jointly created a community leadership panel, which was a group of lay people whose role was to study and prioritize the public health issues in Summit County, and looking what could be done to make the citizens of Summit County healthier in the year 2000 and beyond. In 1996, they published their report, which was entitled Healthy Summit 2000, followed by a Community Health Improvement Plan in 1998, with some strategies to address those identified issues. Healthy Summit 2000 was a forerunner of community health assessments that are now common documents in public health throughout the whole country. Terrorism preparedness started to become a concern in the 1990s, even before the 2001 World Trade Center attacks and the mailing of anthrax spores later that fall. Concern about possible bioterrorism, especially anthrax plague and smallpox, resulted in federal government allocating money to large municipalities to develop plans, trainings, and exercises, and to stockpile medications and equipment to deal with a potential terrorism event. In most cities, this funding which was called the Metropolitan Medical Response System, was housed in the fire department. However, Akron was one of the few locations in the country in which this program was actually housed in a public health department. The Akron Health Department received the funding and worked with Summit County Emergency Management Agency to organize and facilitate the planning for emergency preparedness and response. Until the consolidation of the 3 Summit County Health Departments in 2011, the Akron Health Department was the lead agency for the state public health infrastructure and public health emergency preparedness grants for Summit County. In addition to participating in the community emergency preparedness activities, the Akron Health Department focused on its own departmental preparedness. It developed an emergency preparedness plan and a continuity of operations plan. It trained staff to work with other city and county emergency responders through the incident command system. It purchased supplies, conducted drills and exercises. This served the health department well when responding to incidents such as the 2009 H1N1 influenza pandemic. And now, to take us home, is Mike Smiley.
Thank you, Dr. Ermy. Hey, let's start with a little history for contextual information. The 19th century sanitary movement in England formed the foundation of what we know today as environmental health. It focused on improving urban environments to prevent the spread of disease and advocated for infrastructure improvements, including potable water, sewage systems, and waste management. It prioritized the elimination of crowding in dark and unventilated buildings, access to open green spaces, and separating polluting industries from the places where people lived. These improvements significantly reduced mortality from cholera, typhoid, and other diseases, and led to lasting changes in urban planning and public health policy worldwide. As one of over 100 local health districts in the state of Ohio, the Akron Health Department acted under the authority of the Ohio Department of Health with local control. The state provided financial and programmatic support. The department and environmental health programs also relied on local general funds and income from fees and assessed penalties, as well as state and federal grant monies. In 1977, Ohio established credentialing requirements for sanitarians, now known as environmental health specialists. In Akron, the Environmental Health Division's array of regulated activities and funding sources changed significantly over time. The division's programs were intended to address health-related impacts associated with air, water, food, and housing. The division's first mention in the department's historical record was in 1912 in reference to milk inspections and ensuring milk was safe to drink. In 1918, the Division of Dairy and Food Sanitation was established, and by 1920, 99% of milk produced in Akron was pasteurized. In 1945, a rat control program was added to the environmental health lineup to address urban infestations in the wake of findings from the Johns Hopkins Rodent Ecology Study. In the late 1950s, local meat and milk inspection responsibilities had been removed to the United States Department of Agriculture and the Ohio Department of Health, respectively. Environmental Health Division enforcement responsibilities continued to expand, eventually included, among others, programs addressing air quality, housing, food safety, nuisance abatement, institutional inspections, workplace hazard exposures, vector control, swimming pools and spas, solid waste, and well and septic permitting. All staff participated in emergency preparedness training. Some environmental health programs were conducted under state and/or federal authority. The state of Ohio and US EPA regulations govern well and septic installations in those instances where municipal water and sewer services were unavailable. Solid waste management inspection and licensing was performed under an agreement with the Ohio Environmental Protection Agency. The Ohio Uniform Food Safety Code governed inspection and licensing of food establishments to prevent, eliminate, or reduce food safety issues. Division staff also responded to citizen complaints and assisted in the investigation of foodborne illness outbreaks. In 1985, the Akron Regional Air Quality Monitoring District was created under the provisions of the 1967 Clean Air Act, expanding existing local smoke and air pollution control efforts and established air quality monitoring sites throughout the region. In 1986, a local right-to-know ordinance based on the Federal Emergency Planning and Right-to-Know Act mandated local reporting requirements for chemical storage and releases and required that employees be informed of exposure risks in the workplace and provided with risk reduction training. Chapters 94 and 150 of Akron's Municipal Code of Ordinances provided much of the authority for the Environmental Health Division's code enforcement work. Violations were prosecutable as criminal misdemeanors. Nuisance abatement addressed inappropriate trash and rubbish accumulation and storage and other circumstances which created public nuisances. Vector and pest control activities included rodent control with no-cost baiting of burrows, coupled with the elimination of harborage, a legacy of the Johnson administration's 1960s war on rats. Mosquito control focused on the elimination and larvicidal control of breeding sites and nighttime neighborhood fogging to reduce adult populations. Rabies control included the investigation of reported animal exposures, including bites, and shipping only the head with the intact brain of a sacrificed animal to the State Health Department laboratory for analysis. In the late 1960s, housing code enforcement responsibilities were transferred from the city's building department to the health department, and in 1973, Akron adopted the Environmental Health Housing Code, which set minimum standards for residential property maintenance, a feature somewhat unique among local health departments in Ohio. In 1977, the Akron Childhood Lead Poisoning Prevention Program was funded by one of the largest federal lead poisoning grants and began offering blood lead screening in the nursing division's well-child WIC clinics, along with case follow-up and grants for removal of lead hazards from contaminated homes. In 1996, Akron again updated its housing code to become the first Ohio city to implement administrative penalties for noncompliance, along with mandatory rental unit registration. In 1998, Akron established annual inspections and licensing requirements for tattoo and body piercing establishments, intending to prevent the transmission of bloodborne pathogens, and instituted annual licensing requirements for businesses involved in providing casual day labor employment. When Akron, Barberton, and Summit County Health Departments agreed to consolidation of services in 2010, most of the environmental health programs migrated to the new entity, but housing code enforcement responsibilities and staff were transferred to Akron's new Department of Neighborhood Assistance. Thank you for your attention. I'll turn this back over to Dr. Keck.
Thank you, Mike. Well, in conclusion, I think it's important to emphasize, particularly during these times of attacks on government services, that the Akron Health Department's impact on community well-being rests squarely on the shoulders of its talented staff, who worked wisely and well to always find the next thing that could be done to improve community health status. In 2010, an effort to create a more efficient approach to providing public health services, the Akron Health Department, as you've heard, consolidated with the Summit County Department of Health. Our area's public health history since 2010 has been and will be written by that agency. It's our hope that the work of the Akron Health Department will be remembered and recognized for what it provides, a good and credible example of the importance of coordinated local government efforts to successfully maintain and improve the health and vitality of a community. And now we're open to questions. Thank you for your attention.
So I'm going to read the first one, and then whoever on the panel who would like to answer this, please feel free. The first question is, what would you consider the top 2 or 3 achievements during Dr. Keck's tenure in leading the Akron Health Department?
I'm not sure I could hear it.
So what would you consider the top 2 or 3 achievements during your tenure, Dr. Keck, in leading the Akron Health Department?
Me? Okay. How can I pick 2? Well, I think one of the more important ones was the linkage between the department and academic institutions in the community, particularly the College of Medicine, but also the College of Nursing at the University of Akron and others. The interaction of students, the training of students in practice settings was all not absolutely unique, but we were doing it in a way that was, I think, at least more voluminous in its involvement, because we were connected with the curriculum directly at the College of Medicine as well. And we wrote about it, and the articles we produced at about the turn of the century kicked off a movement that now has taken hold. I think we've reached the tipping point with it, so that now there is a book on academic health department partnerships available and how to do it. And there are a variety of public health organizations, national organizations, that now have people on their staff whose job it is to promote the development of relationships between health departments and academic institutions across the country. And then, well, one of the other things I think was really important was the collaboration we had with many groups, as you've heard us say, but in some ways, particularly the hospitals, because our work with the hospitals allowed us to tap into a source of money that was not available to most health departments. Many of my colleagues around the country, and they heard about what was going on in Akron, actually were a little bit jealous because we were able to develop that linkage, and it helped us with a variety of public health programs, with the development of the federally qualified health center, with the response to public health issues, particularly infectious disease, as you've heard, so that it was coordinated and we weren't giving information to the public from one institution that was different than others. So I think those two were good examples.
Our next question is, were there any particular health concerns or initiatives established by the Akron Health Department with the rubber companies and the industries that dominated the area?
Back to me. The short answer to that is no. We tried a few times, but I never had, at least, the energy to do that successfully. We did work with them on some occupational health programs. The city did establish the Right to Know program, which was aimed at industries in Akron. The idea there was to have a central compilation, a data source, if you will, of all the chemicals stored throughout the industries in Akron. We are a chemical industry town, after all, because we had incidents of fire department personnel responding to emergency calls, usually fires, and not being sure what they were facing, because the usual approach to treating a fire sometimes can make it worse, depending on the chemical. So fire department was asked to do that. They wanted a lot of money to do it, and we did it for about 1/6 of what they were requesting. So we created that I guess, compilation of information with material safety data sheets, so-called, making information very quickly available in the case of an emergency to the first responders. But thoughts about developing wellness programs for workers and so on never really got off the ground.
Our next question is, what were the biggest challenges the Akron Health Department faced?
Money. Money?
Yes, it did. By challenges, you mean that greatly, or which public health problem did we face most, I guess? Yeah, one of the challenge always is getting the resources you need. As you know, public health in this country is under-resourced. We get about 3 or 4% maybe of the national budget that goes to dealing with health issues. We are focused in this country on fighting disease one patient at a time, and that means we focus on clinical responses and cures more than we do on prevention, and that has not stood us in good, that has not helped us very well. Health status in the United States is the lowest among the richest countries in the world. We just haven't done a good job there. And so,
Okay. We have a question. It's how did the local landlords react to the mandatory rental property registration?
They loved it. No, not really. We had a tremendous amount of cooperation from landlords for the most part. It was pretty easy to get people to participate in the program, mainly because we weren't inspecting their houses. We were asking them to give us money so we wouldn't have to inspect their houses. But in reality, there was this very small fee that people had to pay. There was some resentment on the part of landlords, but by and large, it was a pretty innocuous program for them. The fees were not too expensive. The biggest resistance that we got was when we had to do mandatory inspections on properties as a result of multiple sets of orders being issued for violations, or because someone was convicted in court of a housing code violation, which automatically triggered the mandatory inspection clause. It was sometimes affectionately referred to as the landlord death penalty. And it could be quite expensive if you understand that when you have a team of sanitarians going out and inspecting a large number of rental properties all at one time and sending orders out to a landlord. A lot of times people would divest themselves of their properties, change their name, do whatever was necessary, and sometimes they'd actually make the repairs. I see a few people out here who are involved in that kind of endeavor, Mr. Powell, Mr. Christ, and housing was a very difficult place to work because there was never an end to the amount of work that you had to do. And it was rewarding to have tools at our disposal that would allow us to do our job even better. When Akron instituted the administrative penalties for noncompliance, that helped sanitarians do their job much more. But with regard to the rental registration program, it was by and large accepted by the rental property owners in the city as a necessary evil.
Okay. We have a question. It says, so do you think the change from the Akron Health Department to the Summit County Department of Health improved service to Akronites, or did service decrease with a larger customer base?
I was going to say, I'm the only one of the four of us here that went over the transition. These guys all bailed out beforehand. Some a long time before. Change is not necessarily bad. That was the mantra that I and the health commissioner at the time, health director at the time, would tell our staff. And one of the things that Mr. Quaid would say is that if we were going to consolidate, we'd rather do it by design than default, meaning the handwriting's on the wall. You look at Ohio with the number of health departments that have consolidated over the last 20 years. It is significant. So it was bound to happen. Now, is everybody happy from it? No. Even 15 years later, people still have concerns because nothing can be this way that it was in the past. And a lot of the challenges that we had when we were Akron Health Department, particularly money still follows us, and even more so now. So there are new challenges, looking at things like housing, looking at things such as new infectious diseases, new ways of doing things, that services aren't exactly the same as they were. And 20 years from now, services won't be the same as they are now. So as to whether services are less or more, I think for every municipality in the county, it's going to be depending on who you ask. Where I am, where I live in the county, services are just the same, so.
I could add one thing. I happened to have lunch with former Mayor Plisquellic in the last week or two, and he was very proud to tell me that he was very happy when this consolidation occurred because it saved the city of Akron $1 million a year. So maybe it certainly is more efficient than it had been before.
I have a quick question here. It says, whatever happened with the Health Education Center at the Akron Health Department?
The Health Education
The Health
Center?
Education Center, yeah.
The Health Education Center.
You taught in it?
I taught in the Health Education Center for a number of years. So the Health Education Center was initially a program with the Junior League, and it was looking at providing human reproduction, and basically what I call it was Puberty 101 for Akron school 6th graders. And it lasted probably, I don't know if anybody out there remembers, but
25,
20,
at least 25 years.
yeah. So it was like the middle 2000s that it lasted. A lot of schools stopped doing it because of transportation issues, curriculum issues. It's like, why we send kids there? We can do it cheaper in our own place. It was interesting because as it kept going, the kids knew more of what we were telling them than we were telling them. Some of the questions, particularly when the parents were there, the mothers sometimes would come, and the parents, the kids really weren't shy about asking questions with adults there, and I'd see these mothers' eyes just go. So I think part of it was finance, and part of it was there were other ways of conveying the information besides a field trip.
Did the Akron Health Department intentionally address the infant mortality rates, particularly amongst communities of color? And if so, how?
We tried. I don't think we were ever able to demonstrate that we made a huge difference in infant mortality, but we tried in a variety of ways and may have. For example, the prenatal clinics that were in place and prenatal clinics particularly, we of course would take anyone who came, but we were particularly focused on people living in poverty, and particularly on the youngest women who were pregnant, because their risks were so high, and particularly even more in those young women who had a number of risk factors besides their age, such as substance abuse, homelessness, whatever it might be. We had a special program with the hospital. Hospitals were particularly interested in helping us with this because they wanted to diminish the number of premature births and the number of infant deaths. They also, part of that was to diminish the number of severely ill infants that came in the early days of life. So with our prenatal clinics, we did that. We also focused a bit on contraception. We did not really provide contraception, but one of the partnerships we developed was with Planned Parenthood in Akron. So we particularly wanted to help those women who had had a pregnancy, especially a difficult pregnancy, and who did not want to get pregnant again soon, to get the help they needed. So we referred clients to Planned Parenthood and actually sent some nurses to help Planned Parenthood deal with that volume that was increased by those efforts. And now I think later we were beginning to look at the social determinants of health as we became increasingly aware of the impact of homelessness, poor housing, low education, low income, all of that on public health. But that's really where the emphasis, I think, increasingly lies now, and was just beginning when the Akron Health Department went out of existence, or at least was in its early stages. Yeah.
Did the health department have any involvement with the health of inmates in the county jail?
I'm sorry.
Did the health department have any involvement with inmates' health who are at the county jail?
Inmates. Jail, yeah.
Yeah.
The answer is yes, for a while. It was probably the 1980s when we hired Dr. Yatsu, hired Dr. Jeffrey Yatsu to work and provide adult health services in the health department, particularly high blood pressure control. But at that time, the city was running the workhouse down in what's now part of the national park, I guess. And the workhouse had limited health services. My predecessor, Dr. John Morley, had worked in the workhouse a bit, trying to provide some health care there. And that was an area that we were concerned about, and so Dr. Yatsu took on that process, and went to the workhouse on a regular basis, held a clinic there, and dealt with the health issues of the people who were incarcerated there. We didn't work in jail health anywhere else, I don't think. It's just that one spot.
Well,
did that change later? No.
No, but we were also very concerned when they had disease outbreaks there. So they consulted us a number of times when they had a number of infectious disease concerns or outbreaks. So I spent time in the jail.
Okay, we have time for just a couple more, and we have, what was the most challenging event or time frame for each of you during your time in the health department?
Each of us. You haven't answered one.
Did you go first?
Okay, most challenging, I think, was always trying to match the needs with the resources available. I was a deputy director, primarily internal management of the department, working with the budget, ensuring that we had the funds so we could make the maximum impact on the health of the Akron community. That was always challenging. I think we had a great working relationship with the city of Akron. And the city of Akron, I believe, was very gracious with the funding. And then also, we were able to leverage a significant amount of state funds. And the collaboration with the Summit County and Barberton Health Department helped us maximize that. And also community players. The health department didn't really feel it needed to be doing everything for everyone. If there was an agency out there that provided adequate service and was really doing a good job, there was no need for us to get involved with that. So that was something that helped us monitor the health of the entire community, but also, look at it frugally, getting the most bang for the dollar. That would be my biggest challenge.
Yeah.
My biggest challenge was White Powder Awareness Month, which was the fall of 2001 after the World Trade Center attacks, when we had the anthrax through the mail, and we spent 3 months, basically on no sleep. We were in the beginning of our emergency preparedness, having to deal with a lot of, even in those early days, misinformation, disinformation, people's panic. People came home from work, put their lunch bag on the counter, picked it up, saw white powder, and called. So that was trying to deal with balancing what was realistic to what was potential and trying to calm people's fears. I always said that if I could go to every house individually and talk to people individually, I might have settled it down a bit, but I could not do that because I wasn't getting enough sleep, and you actually sent me home once.
I did.
Yeah. So,
I did.
because I was looking like I shouldn't be there.
Well, I could probably say that being banned from city council and city hall, but on a personal note, but really it was probably the wind down of Project Happen after the police shooting at the Blanche Street when Officers Zilli and Page were wounded, and we had quite a lot on our hands at that time. We had to examine our relationship with the police department, the underpinnings of the Project Happen movement, and it was quite exciting. Dr. Keck was involved in trying to calm the waters and did a very good job of that, which made my work quite a bit easier. We had a number of conversations about how best to pursue putting a lid on things and trying to work with the police department to make sure that we still had a relationship with them, and at the same time understanding that that police officers following housing sanitarians into inspections and arresting people was probably not the way to go.
Yeah, I think my biggest challenge was probably trying to figure out what do we do next. What do we do with the limited resources we have to make an additional improvement in community health status? That was the sort of thing that was driving me all the time. There were lots of other issues that were important, of course, but that's what went into my thinking, and I think the department's planning for what we should do, what was possible within the circumstances. And to do that, of course, we had to improve our capacity to understand what the community's health status was. So we made a significant effort to do that, get the data we needed, and then argue among ourselves, well, with the resources available now, what else can we do?
So our last question, and our panelists can decide who will answer this one, but what do you now consider to be the legacy of the Akron Health Department? And if the department were still in existence, what would the priorities be?
Well, gee, that's not the history. My crystal ball has been broken for a while, given the circumstances of currently in the United States. I think if the health department existed now, we'd be like every other health department, reeling from what's happened at the federal level, trying to recover our own thinking about what we can do at the local level to fill whatever gaps may occur. I think we'd be worried a lot about how much staff we had, how much funding we would have for programs, because we wouldn't be getting the same amount, if any, from some of our usual sources. We have always looked to the federal government for the final sort of advice on how to approach public health problems. We always look to the CDC, we look to the vaccine approval committees, we look to Department of Health and Human Services, and now I think we would feel we couldn't trust that information. So I think we would be scrambling quite a bit to try to figure out how we can at least keep the public health status in our community from declining during this period, which would mean we would perhaps at times find ourselves in opposition to, or at least in competition with, some of the usual sources considered before the gold standard in the United States, now considered questionable at best. I think that would consume us. Actually, it's a good time to be retired.
But I think our legacy is the collaboration. Dr. Keck brought up about collaboration with hospitals. I worked with the hospitals, I worked with the other health departments, and went to a lot of meetings around, as we all did. And people were very much surprised that we were able to get along and get things done. When I would go to emergency preparedness meetings across the country, and other cities were going, how did you get all these people together? I mean, we had the schools, we had businesses, we had fire across different municipalities, law enforcement, health, and public health, and they were amazed. So I think that that collaboration allowed us to do things in Akron that maybe other places could not do, because we were able to look at other strengths, get other perspectives, as Greg was talking about, not duplicating things that other agencies or organizations might be able to do. And I think that's continued. I hear it when I still in organizations and things. And so I still hear about Akron, Summit County being a very collaborative place to be.
Well, thank you again to all of our panelists. This has been a very engaging, very informational Discovering Our History Forum, and we're so proud to have the Akron Health Department serve as our initial forum of this series. On October 22nd, we will be back here at the Akron Summit County Public Library for the Akron Water Department Forum. On October 29th, so close by, we will have a forum again here at the library on Akron's immigrant communities. On November 3rd, we will be here again with the International Soapbox Derby. And on November 13th, we will have our last Discovering Our History Forum, which will be on Akron's Jewish history, and that one will take place at Temple Israel, Akron. Again, please help us to thank all of our panelists for the Akron Health Department. And again, for more information on all of these events, please visit our bicentennial website at akron200.org. Thank you.